Assalamualaikum Puan, my name is Aify Adawiyah. So today I'm going to provide the oral hygiene instruction through this online teledentistry session. The aim of today's session is to explain your gums condition, why oral hygiene is important for you, and to demonstrate the correct technique and tools that you can do at home to maintain your oral hygiene. So before that, I would like to explain about the anatomy of the tooth. So generally, we know there are the crown, root, and bone, but there are more behind it, which is called the periodontium. So periodontium consists of 4 structures, which is the gum or the gingiva, cementum, periodontal ligament, and also alveolar bone. So when these 4 structures are healthy, it means your teeth are stable and your gum is not bleeding. But when the structures are not healthy, it will progress into gum disease, or also known as periodontal disease. So now I'm going to explain to you about the progression of periodontal disease. It starts from the healthy gum, which leads to gingivitis and leads to periodontitis. So this gingivitis and periodontitis is also known as the gum disease. The gingivitis is the early form of gum disease, which occurs due to the plaque and bacteria that build up in the mouth and leads to infection. Meanwhile, the periodontitis is a serious gum infection which can damage the soft tissue and the bones around the tooth. So, this gingivitis and periodontitis occur due to dental plaque. So, what is dental plaque? Dental plaque occurs when brushing and flossing of the tooth is not done regularly. It will cause the dental biofilm to grow and it becomes the dental plaque, which is a thicker and more harmful layer. Now I'm going to explain about your gums condition. So from those intraoral photos, we can see that there are plaques along the gingival line, along the gum line, and also there are gum shrinkage. And next, from this periodontal charting, we can see that there are more than 5 mm pocket depths, and from the radiograph, we can see that there are severe bone loss. Based on this examination and diagnosis, we can conclude that you have periodontitis. So this is important because since you also have type 2 diabetes, which is an important factor because diabetes can make the gum disease progress more faster and healing slower, so especially if the plaque control is inadequate. With proper periodontal treatment and plaque control at home, your condition can be maintained and stabilized. However, without a good oral hygiene, the disease may progress worsen and it will lead to further bone loss or even tooth loss. Now I'm going to explain to you why oral hygiene instruction is important for you. This is because for patients with periodontitis and diabetes, oral hygiene instruction is especially important because the bacteria can trigger the inflammation and worsen the gum disease and also the blood sugar control. Besides that, it helps to prevent further bone loss or even the tooth loss. It also to improve the treatment outcome and to reduce gum bleeding and swelling, and lastly to maintain a long-term gum health. Now I'm going to show you the oral hygiene aids that you should include in your daily use. So the first one is the soft bristle toothbrush. Next, the second one is the fluoridated toothpaste. Next is the interdental brush. And lastly, the dental floss for the area where the interdental brush cannot fit. Now I'm going to demonstrate to you the correct techniques to use these oral hygiene aids. Now I will demonstrate the correct toothbrushing technique recommended for patients with gum disease, known as the modified best technique. This technique is especially important for patients with periodontal disease because plaque tends to accumulate at the gingival margin, which is the area where the tooth meets the gum, also known as the most common area for plaque accumulation. If plaque is not removed from this area, it can cause gum inflammation, bleeding, deepening of periodontal pockets, and further bone loss. Therefore, proper toothbrushing is essential to prevent the progression of gum disease. First, angle the toothbrush bristles 45 degrees to the long axis of the tooth, directing the bristles gently into the gingival margin. This angulation is important because it allows the bristles to clean just beneath the gum line where bacteria cannot be removed by rinsing alone. If the brush is placed straight or angled incorrectly, plaque at the gum margin may be left behind. It is also important not to press too hard as excessive force can damage the gums and lead to gum recession and sensitivity. Next, make small circular motions several times, followed by rolling the brush away from the gingival margin. This movement helps loosen plaque and sweep it away from the gums. The movement should be gentle and controlled. Aggressive horizontal scrubbing should be avoided because it can cause abrasion of the tooth surface and injury to the gums. The same technique should be applied at the lower lingual surfaces of the posterior teeth. These areas are often difficult to reach with the tongue and toothbrush, and they commonly accumulate plaque and calculus. Failure to clean these areas properly may result in persistent gum inflammation. When brushing the palatal aspect of the upper anterior teeth, straighten the toothbrush while ensuring the bristles are in contact with the gingival margin and tooth surface. This position allows better access to the narrow spaces behind the front teeth. Similarly, when brushing the lingual side of the lower anterior teeth, the same angulation and movement should be used. These areas are prone to plaque accumulation and gum recession if not cleaned properly. Some patients may notice bleeding during brushing. This bleeding is usually caused by inflammation and not by the toothbrush. With consistent and correct brushing, bleeding will gradually reduce as the gums become healthier. Teeth should be brushed twice daily, especially before bedtime, for at least 2 minutes. Nighttime brushing is especially important because saliva flow reduces during sleep, which allows the bacteria to multiply more easily. Now, I'm going to continue with the interdental brush demonstration. Toothbrushing alone cannot effectively clean between the teeth. The remaining areas between the teeth must be cleaned using interdental aids. For patients with periodontitis, interdental brushes are preferred because the interdental spaces are often wider. First, choose the correct size. Make sure to find an interdental brush size that fits comfortably between the spaces of your teeth. The brush should not be forced in and it should not feel loose. Using the correct size ensures effective plaque removal without causing trauma to the gum. Place the interdental brush in the space between your teeth and insert it gently. Move the interdental brush with gentle back and forth motions for at least 4 to 5 times. Avoid twisting or forcing the brush. You may experience slight bleeding at the beginning. This is due to the gum inflammation and should reduce with regular use. Clean your interdental brush after use and replace it when the bristles become worn. Clean all spaces systematically to avoid missing any area. Interdental brushes should be used once daily, preferably at night. Next, I'm going to continue with the dental floss demonstration. Dental floss is used in areas where interdental brushes cannot fit, especially between tightly spaced teeth. Flossing helps remove plaque from areas that are otherwise inaccessible. This helps reduce gum inflammation and prevents further periodontal breakdown. So first, for floss preparation, take about 50 centimeters of dental floss and wind most of it around each middle finger. Use your index finger and thumb to stabilize and control the floss. Next, for the flossing technique, once the floss passes the contact point between the teeth, form a C shape hugging the interproximal surface of the tooth. Move the floss gently up and down to clean the side of the tooth. Repeat this for the adjacent tooth surface. Avoid snapping the floss into the gums, as this may cause injury. Dental floss should be used once daily, ideally before brushing at night. By combining proper tooth brushing, interdental brushing, and flossing technique, plaque can be effectively controlled, helping to maintain healthy gums. So now I'm going to explain to you about the periodontal treatment that we will provide, which is the first one is scaling to remove plaque and calculus from the gum line. The second one is root debridement to remove plaque and calculus from the root surface. So after this treatment, you will need periodontal visits, usually every 3 to 6 months, depending on your condition. So after this treatment, you will have some post-operation complication, which is the gum recession, the spaces between teeth, and also the tooth sensitivity. So to summarize, maintaining a good oral hygiene at home is especially important for your periodontal disease, especially with your diabetes. Your cooperation and consistency play a major role in maintaining your gums healthy. If you have any question, please contact us directly. And thank you for your time and cooperation. Take care of your oral health, and I look forward to see your improvement in the next visit. Thank you.